and we are a group of people with our aim wanting to discuss with you, to learn from you.
With very, very great efficiency, this patient had chronic pain.
The compartment that there are abnormal clusters at the red cell surface, and these clusters are recognized by...
It's an emergency. What is an emergency is to remove.
Which tools have you found to be most effective?
Engineer, the main engineer of my unit, in charge of all
different pressure of oxygen, and at different time, helping us to have a pattern of diffraction of
She's needing surgery. I left her, but she had a positive.
No, this change in color of the sclera, no change in urine.
For every patient.
1.5 grams.
This preceptorship is not really teaching, it's more exchanging and more inspiration by working together. So thank you very much.